This is Radio Health Journal. I'm Nancy Benson. This week, why America's pets are facing a weight problem.
I know what the future holds, and I know if they don't change, that it's going to be devastating. It's going to be heartbreaking.
Some tips to help your pet shed some weight when Radio Health Journal returns.
With the summer break gear tucked away for the season and new school backpacks at the ready, it's time to be thinking about serving up tasty, healthy meals and snacks for those on-the-go, activity-filled days of fall. Including foods that kids love to eat, like fresh grapes, makes it easier. Registered dietitian Courtney Romano is a health advisor for the California Table Grape Commission.
Stock your kitchen with foods that are easy to eat, that travel well and can serve multiple functions, such as hummus, whole grain crackers, cheese, fruits, and veggies. For example, heart-healthy grapes can be tossed into yogurt or a breakfast smoothie, packed into lunches or into sports bags for a fresh, hydrating snack. A bowl of grapes can serve as an easy side dish to a simple dinner of soup and sandwiches.
Grapes from California are a natural source of antioxidants and other polyphenols. With just 90 calories for a 3/4 cup serving, no fat or cholesterol, and virtually no sodium, fresh grapes are a smart choice. Visit grapesfromcalifornia.com for more information.
America's obesity epidemic is everywhere. 2/3 of us are at least overweight, and the proportion who are severely obese is rapidly increasing. But what we hear less about is that America's pets are facing a similar problem.
Pet obesity is without a doubt the number one health threat our nation's pets face. To try to get a handle on how big the problem was, we began conducting prevalence surveys every year, and what we found is that over half of the nation's dogs and cats weigh too much.
That's Dr. Ernie Ward, a veterinarian, author, and founder of the Association for Pet Obesity Prevention. He says an overweight pet can mean increased risk for many severe health problems.
The problems associated with obesity in pets are similar to those we see in humans. So type 2 diabetes is just at incredible levels now, especially in cats in the U.S. We see an exacerbation and even a creation of osteoarthritis, so crippling arthritis of the hips, the knees, the elbows, the shoulders. We see high blood pressure. There's evidence to suggest that kidney failure in dogs and cats is associated with excess weight. And probably my biggest fear is the relationship between excess fat tissue and cancer. We are seeing an explosion of data suggesting that the more fat a dog or cat is carrying, the more at risk they are for a wide variety of cancers.
And it's not that animals are simply a few pounds heavier than they should be. He says more pets than ever are exceptionally overweight.
Our yearly prevalence studies clearly indicate that this is a worsening problem. And where the real issue is for us is the number of obese pets is expanding. So we rate pets as being overweight and obese, and these have clinical meanings to doctors. But the reality is an obese pet is at greater risk of developing diseases and a shortened life expectancy than one that's simply overweight. And what we're seeing is that in our prevalent studies, we're seeing more and more obese pets. So these aren't dogs or cats that are just 1 or 2 pounds overweight. These are dogs and cats that are 10, 20, even 30 pounds overweight. So that's the most disturbing aspect of our research over the years.
Ward says the reasons so many animals are growing to obese levels are relatively straightforward.
We've got issues such as the urbanization of America. So now we don't live in areas where we have access to farmlands where the dog or cat can roam. We don't even play outside much anymore. So as we've enclosed our lives within the four walls of apartments and small homes, we've also taken away the opportunity for pets to get aerobic activity. The other factor is we're feeding more calories than ever before. Today's pet foods are more calorically dense than in previous generations. That means that each cup or can has more calories than they did 20 years ago.
Dr. Deborah Linder agrees that it all boils down to diet and exercise. Linder is a research assistant professor at the Cummings School of Veterinary Medicine at Tufts University. She says exercise is important, but these days it's more complicated than ever to determine the proper diet for pets.
There's no one diet that's best for all dogs. So when I try and help owners guide them to which diet is best, I take a lot of things into account. Certainly that it be formulated for weight loss. So I want to make sure that even though we're cutting calories, we're not cutting essential nutrients as well. Some other things we may take into account are protein needs, fiber, whether that may help some pets feel more full, but it also may mean they have to go to the bathroom more. So then we kind of think about pet owner preferences, what's the lifestyle like, canned food versus dry food. There are a lot of things that go into it.
Linda advises that it's a good idea to seek professional help to cut through the noise of so many different pet food options.
I think the most important thing is just making sure that you're not trying to go it alone, that pet owners are engaging their veterinarians too, because unfortunately there's a lot of marketing out there and advertising of pet foods. And if you just go by that advertising, you might not know what facts are. Foods that are marketed for weight loss don't necessarily have a lot of regulation or guidelines around them. So you may actually be picking a food that's more calories than the food you're currently feeding. So it's really important to work with your veterinarian and get the facts.
But Linda says before you go to the vet's office, there are a few things pet owners should do.
Something that can help before you get there, or if you want to try it on your own, is starting with just a diet journal. So writing down over the course of a few days everything that passes the lips of your pet's mouth. That includes certainly their main diet, but also treats, anything you may give if you need to give medication, if you need to use food for that, any chews that they might have, for example, rawhides or dental treats. All of those things contribute calories. So the best thing that we can do from the starting point is to get a good assessment of what calories the pet is consuming before we start a plan for them.
And if owners are unsure whether they should start keeping such a journal, Linda recommends a quick test to help determine whether a pet has a problem.
The best thing that an owner can do to determine if their pet is a healthy body weight or body condition, instead of the body mass index that we have in people where we measure height and weight, dogs come in different sizes. So the best thing that you can do is feel over your pet's rib cage, whether it be a dog or a cat. And when you feel over their ribs, it should be no more padded than the back of your hands. That's a really quick and easy way to determine if your pet's an ideal weight.
And in addition to finding the right pet food, Ward says owners need to be more aware of how many treats they're handing out.
The real root of the problem is the desire to please our pets. I mean, we feel guilty often. We have to leave them alone, or we don't have time to take them for a walk or play. So we fill that void with food. And this really is an obstacle that I think as a society and culture we're going to have to come to grips with. Food equals love to many pet owners, but it doesn't equal love for every pet. What pets really crave is our attention, our interaction. So we have to realize as pet owners that maybe reaching for that cookie isn't as satisfying to that dog as just petting them for a few minutes.
Ultimately, the problem of pet obesity isn't easy to combat. However, Ward says a loving pet owner really has no choice. Being overweight or obese is simply too harmful to the animal's well-being.
Every time when I'm in the exam room and I've diagnosed a dog or a cat and I say, hey, we need to lose 3 or 4 pounds, the owner thinks, well, that's just not a big deal. If they could sit in my chair and fast forward to the thousands of cases I've seen over my career to the end point, that is the dog or cat that's now suffering from these consequences of feeding a little bit too much every day, not paying attention to the weight, they would change their ways. And that's really the most heartbreaking dilemma for me as a practicing veterinarian. I'm sitting in the chair, I'm saying we need to lose a few pounds. I'm doing that because I know what the future holds. And I know if they don't change, that it's going to be devastating. It's going to be heartbreaking. So the one thing I would say is if you want your dog or cat to lead a long, healthy, vital, vigorous life, keep it lean and healthy.
So the next time your pet completes a trick or deserves a reward, try using some love and affection instead of treats. If your pet seems overweight, talk to your vet about it. The experts agree it'll be worth it in the long run. You can find out more about our guests on our website, radiohealthjournal.net. Our writer-producer this week is Evan Rook. Our production director is Sean Waldron. I'm Nancy Benson.
Radio Health Journal returns with medical notes in just a moment.
Experts estimate that 5 to 10% of the asthma population suffers from severe asthma. Some patients experience limits on everyday activities, like walking and household chores, yet they think their symptoms are well controlled. This misconception can be life-threatening, but asthma can be managed if you take action and take control, according to Dr. Ellen Becker, licensed respiratory therapist at Rush University Medical Center.
Draw up an asthma action plan with your doctor. It should include knowing your asthma triggers and avoiding them. It should also include a plan for what to do if your symptoms worsen so you can address the issues before an attack becomes severe. Medication is important, but also discuss lifestyle changes with your healthcare provider because diet, exercise, sleep, and stress can all affect your asthma symptoms.
The Chest Foundation and Allergy and Asthma Network want to remind you that well-controlled asthma doesn't limit everyday activities. Find out more on managing asthma symptoms at asthma.chestnet.org. That's asthma.chestnet.org.
Medical notes this week. Next time you're feeling stressed, try talking to yourself in the third person. A new study in Scientific Reports finds that when people refer to themselves by name, they are able to reduce their brain activity within a second. Researchers say this translates to managing stress and helping process negative emotions in the moment with relatively minimal effort. The study finds this technique may allow you to think about yourself the same way you think about others, creating psychological distance and helping ease negative emotions. A vacuum-sealed brick of coffee is rock hard and immovable, and doctors are using that property to improve head and neck surgery. Scientists at Vanderbilt University fit a swim cap-like headpiece on surgical patients, fill it with coffee grounds, and vacuum seal it to keep their patient locked in position. Even subtle moves of a patient's skin can throw off surgical coordinates, but with coffee grounds, researchers say, surgery can be much more accurate. And finally, many of us are familiar with freckles on our skin, but you may also have freckles on your eyes. Researchers find that dark spots that occur on irises aren't cancerous, but they could mean you're at greater risk for cataracts, macular degeneration, and other diseases related to sunlight. A study in investigative ophthalmology and visual science finds that more eye freckles are found in older people who have a history of severe sunburns, as well as those who have light-colored eyes and who haven't made a habit of wearing sunscreen. And that's Medical Notes this week. More in a moment.
Efforts to prevent undertreated pain have led to a significant rise in opioid prescriptions and, unintentionally, a staggering increase in addiction and death. The American Academy of Orthopedic Surgeons and the Orthopedic Trauma Association have launched a prescription safety campaign to educate orthopedic surgeons and their patients about opioid dangers and treating pain safely. It includes a print and radio campaign with messages like this.
Hi, Vicki. How's your knee doing?
It feels better, doctor. Those painkillers worked great. I was hoping to get some more.
We're being very careful with prescription painkillers. Let's continue with therapy and off-the-shelf anti-inflammatories for now.
Today, patients learn that some pain can be expected and managed safely. The campaign also includes a physician pain relief toolkit and a new patient information page at orthoinfo.org/prescription safety. Find out more there. That's orthoinfo.org/prescription safety.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.